Welcome to the Dermatology Studio with Dr. Yusra Ayaz.
Welcome to The Explainer. Today, we're diving deep into the comprehensive playbook for managing psoriasis, a condition that, as you'll see, goes way more than just skin deep. So, first things first, let's get on the same page about what we're actually dealing with here. Psoriasis isn't just a simple case of dry skin. Oh no. It's a chronic immune condition where the body's internal signals kind of get scrambled. Your skin cell factory gets a faulty message to go into overdrive, producing new cells way too fast. And that pileup is what creates those distinct plaques you see on the surface. And this affects a lot of people. We're talking 2 to 3% of the entire population. So for millions, the single most important question is, how in the world do you get it under control? Well, today we are going to map out that exact playbook for you step by step. All right, so let's start at the beginning, the very first line of defense. Therapies that you apply directly to the skin. This is the front line for most people when they start out. Think of this as your starting toolkit. It's got the whole range, from simple moisturizers, which we call emollients, that just help lock in moisture, all the way up to some really sophisticated new agents that target specific parts of the immune response. Let's take a closer look at the main players. With these topical treatments, it's really a balancing act between power and potential problems. Corticosteroids are the workhorses here. They're fantastic at reducing inflammation, and they're easy to use. The catch? Long-term use can thin the skin. Now, vitamin D analogs work in a totally different way, by telling those overactive skin cells to just slow down. But, and this is a big one, there's a risk of raising calcium levels in your blood, which is why there's a strict weekly limit and why monitoring is so important. Now let's talk about some of the classics, dithranol and coal tar. I mean, these have been around for a long time, and for good reason. The secret sauce is using them in very specific, structured routines. Take the Ingram regimen. You combine a tar bath with UVB light and dithranol in a special paste. The results can be incredible. Same idea with the Guckerman regimen, which pairs coal tar with UVB for really long-lasting results. Yeah, they can be messy and they can stain, but you can't argue with their track record. And this is where things start getting really smart. We're moving towards more targeted topicals. The retinoid tazarotene, for instance, it actually binds to specific receptors in the skin cells to put the brakes on their growth. Then you have calcineurin inhibitors. These are cool because they block the immune cells, the T cells, that are driving the inflammation in the first place. And their biggest selling point? They don't cause that skin thinning, which makes them an absolute go-to for sensitive spots like the face. But wait, there's more. The innovation in this space just keeps on coming. We've got newer drugs that offer even more precise ways to shut down inflammation. Tapinarof, which just got approved in 2022, works on something called aryl hydrocarbon receptors to calm everything down. And then there's roflumilast, which blocks a specific enzyme, and it's proving to be a real game changer for those tricky-to-treat areas like skin folds. Okay, but what happens when the psoriasis is too widespread for creams to be practical? Well, that's when we climb to the next rung on the ladder. And this next step uses a tool you might not expect: light. Now, let me be absolutely clear. We are not talking about going to a tanning bed, not even close. This is a precise medical treatment that uses very specific wavelengths of ultraviolet light in a totally controlled environment. That light actually gets into the skin and tells the cells to stop multiplying so fast, and it calms down that overactive immune response. Now, choosing the right kind of light therapy is crucial. Generally, the first choice is narrowband UVB. It's safer all around, especially for kids and during pregnancy, and it has a lower long-term cancer risk. The other option, PUVA, is more of a heavy hitter. It combines UVA light with a medication that makes your skin more sensitive to it. It works great on thick plaques, but it comes with serious downsides. It's known to cause birth defects, so it's a definite no in pregnancy, and it has a well-established higher risk of skin cancer over time. And because of those risks, PUVA has some hard and fast rules. There are absolute, non-negotiable contraindications. Things like pregnancy, certain autoimmune diseases, or genetic conditions that make you sensitive to light. And of course, you have to be able to follow all the safety rules to the letter. So what happens when psoriasis is severe, widespread, or just isn't getting better with topicals or light? That's when we go to the next level, therapies that work from the inside out, tackling the problem throughout the entire body. And this is where we bring in the bigger guns. The toolkit here includes traditional oral medications like methotrexate that kind of turn down the volume on the whole immune system. And it also includes the newer, super targeted biologic drugs that are usually given as a shot or an infusion. With these powerful drugs, there's always a trade-off. You get high effectiveness, but you have to commit to careful monitoring. Methotrexate is a once-a-week pill that's very effective, but it requires regular blood tests to check your liver and blood counts. Cyclosporin works even faster, but you have to keep a close eye on your kidney function and blood pressure. Okay, now for those who can't take drugs that suppress the immune system, the systemic retinoid acidartidine is a vital option. But, and listen closely here, this is one of the most important warnings we'll cover, it is highly teratogenic. That means it causes severe birth defects. Pregnancy is absolutely forbidden while on the drug and for a full 3 years after you stop taking it. It's a non-negotiable. On the newer side, you have apremilast, which is an oral pill with generally milder side effects. And that brings us to the true revolution in psoriasis treatment: biologics. Seriously, this was a massive leap forward. If those older systemic drugs were like a shotgun, kind of hitting everything in the immune system, biologics are like guided missiles. They are engineered to find and block one specific protein that's causing all the inflammation. And what's so amazing is that we now have different classes of these guided missiles. The first ones went after a protein called TNF-alpha. Then, scientists developed drugs that could block other inflammatory signals, like interleukins 12 and 23. The newest ones go after interleukin 17. Having this growing arsenal lets doctors get incredibly precise and tailor the treatment to what's driving an individual's psoriasis. Okay, we have covered a ton of ground. So how does this all come together? Let's look at the full playbook and talk about the crucial role that you play in your own care. This treatment ladder is the perfect visual for how it all works. From mild disease, you start on the bottom rung with topicals. As things get more severe, you climb up to phototherapy, then to systemic drugs, and finally to biologics. And notice, there's a different path if psoriatic arthritis is part of the picture. In that case, systemic treatments are often where you start. And please remember this, treatment is not just about prescriptions. Psoriasis is a chronic condition, and it's deeply connected to your overall health. Things like managing stress, keeping a healthy weight, and quitting smoking. These aren't just nice to do, they are absolutely critical parts of a successful management plan. Look, the entire goal of this explainer is to empower you with knowledge. Because when you understand the playbook, you can have a totally different, more informed conversation with your doctor. You stop being a passive patient and become an active partner in your own health. And that, right there, is when the best outcomes happen. And that is the truly exciting frontier here. As the research continues and our treatments get even smarter and more targeted, the goal itself is starting to shift. It's moving beyond just managing psoriasis. The new goal is to make its impact on daily life disappear completely, to get to a future where, for all intents and purposes, psoriasis becomes an invisible disease.